When diagnosed with breast cancer, survival is, of course, the greatest fear. Then there's the consideration of hormone replacement therapy and many, many mixed messages. Terry Suresh, nurse practitioner and founder of Hormonal Health and Wellness Centers, is here with some information about hormone replacement therapy and breast cancer. Welcome, Terry.
Hi.
Good to have you here
Thanks.
today. You've said hormone imbalance in the past can happen in women at a much younger age than people sometimes think. First of all, let's just start off with what the symptoms may be.
Right. Well, I'm very passionate about testosterone, as you know, and those testosterone deficiency symptoms can start as early as our 20s, but definitely in our 30s, and they're mostly brain symptoms like depression, anxiety, irritability, mood swings, brain fog, difficulty focusing, not sleeping well at night, low libido. Those are all testosterone deficiency symptoms.
Okay, so many breast cancer survivors are suffering from hormone deficiencies, and doctors have said do not get hormone therapy. This is a controversial topic.
Yes.
What's your opinion for cancer patients?
Well, it is a controversial topic, and the message that I want to share today is there are options for breast cancer survivors, and the options lie in testosterone replacement therapy. Now, there's been controversy even around testosterone therapy because testosterone can convert to estrogen a little bit.
That's what we were talking about.
Yes, and the best news is this testosterone pellet that has an estrogen blocker in it, and it has been shown in many studies to not only provide great relief, but also to, there was a great study that had 1,000 breast cancer survivors in it. They studied these women over 8 years with the testosterone pellet with an estrogen blocker, no recurrence in breast cancer, and most importantly, they had 100% relief in their symptoms. And it's great news for breast cancer survivors who have been told you can never have hormones. It's like a death sentence almost for breast cancer survivors from the standpoint of they got through the battle of breast cancer, but now they have the misery of hormone decline for the rest of their life. So it's a great news.
And of course, the underlying fear is that breast cancer survivors would be at more risk of
for
being
recurrence
exposed to estrogen because they've already had cancer. Okay.
Absolutely.
You say there are studies that show testosterone can not only be safe for breast cancer survivors, but preventative for all women.
Yes.
So
hundreds of studies show testosterone to be very protective to the breast. It actually downregulates or decreases estrogen stimulation of breast tissue. So we have literally, I can't even count them. I have so many in my arsenal, hundreds and hundreds of studies that show testosterone to actually protect the breast from the stimulation effects of estrogen.
Okay. Breast cancer prevention is something that you're very passionate about. Some of the other things that women should consider for prevention and protection.
Definitely, there's some key supplements, and I'm all about the supplements and the hormones. Vitamin D, low levels. Vitamin D levels under 60 hold a 5-fold increased cancer risk, with breast and colon being at the top of the list. Iodine is profoundly preventative for breast cancer. There's a wonderful book, a resource called Breast Cancer and Iodine, written by Dr. David Derry, that has some phenomenal information for women who may be afraid of breast cancer, or breast cancer survivors, or have family members. Iodine is a key mineral to go along with that for protection.
Well, prevention is something that we're all interested in.
Right.
You have a free webinar tonight at 7.
Very passionate, of course, going deeper. This isn't a whole lot of time to talk about it, but I have a webinar tonight at 7 o'clock where I'm going to go really deep dive into all the different hormones, the different types of hormones, the protection. I'll get it a little more into the studies around breast cancer, heart disease, Alzheimer's disease, osteoporosis, and a whole lot more. ReclaimYourLifeWebinar.com.
All right. Thank you, Terry.
Thanks.
Appreciate your passion on this. You can call Hormonal Health and Wellness Aesthetic Centers for more information. In Southlake, the number is 817-328-8376. In Rockwall, 469-402-1877. And you can find out more at hormonalhealthandwellness.com. In honor of Breast Cancer Awareness Month, mention GMT and get a complimentary bottle of iodine, vitamin D, and DIM supplement at your initial visit.